Welcome to the American Institute of Healthcare Professionals video on counseling and ethics. And this is part one. There are going to be two parts to this series on ethics and counseling. And what we are looking at in particular today are some of the basic standards and concepts that are expected from a counselor. So many who are already licensed counselors have a thorough understanding of what ethics is and what is expected according to the standards within their particular profession. Unlicensed counselors who work within the field of human services, though, might not have as much of an understanding of this, especially if they are not licensed or they have gone through an ethics course in the past. So many pastoral counselors who are excellent counselors, they're very professional, but they may not have yet experienced what is expected within the standards. So ethical standards help professionals cause no harm. They stem from the Hippocratic Oath. And in the medical field, they first came under appearance through Thomas Percival in England, who had a hospital facility that he managed, and he wanted to ensure that particular standards were met by his nurses and his professional staff. So that's where we begin to see a professional standard set for individuals working in a particular field. Now, obviously, the primary ideals of truth, justice, causing no harm are universal across various fields, whether in nursing or in counseling or in the case of law. So there are universal concepts that are going to be applied in the variety of standards you might come across. But individual careers and professionals adhere to some unique standards that help govern each discipline. For the purposes of what we are dealing with in terms of mental health, counseling, and so forth, clinical counselors and non-clinical or non-licensed or pastoral all adhere to a particular variety of ethics when it comes to counseling and dealing with the client. The ACA, which is the American Counseling Association, the APA, which is the American Psychological Association, the AACC, which is the American Association of Christian Counselors, the NASW, which is the National Association of Social Workers, the AAMFT, which is the American Association of Marriage Family Therapists, and as well as the NOHS, which is the National Organization for Human Service Professionals, all have very, very similar standards. Now, some of them have up to 50 or more, some of them have less, but all of them usually have a listing of standards of care and professionalism, not only with the client, but also with in the field itself, their profession, within fellow colleagues, and also to students, and also finally to their employer. So sometimes they are subdivided into categories when you look at these. So any of you who might be taking a course in ethics that we offer, those will be available to print out and listed as links so that you can look at them carefully and then apply them to various case studies. The primary standards include, of course, doing no harm to the client and patient. And again, it's important for all counselors, licensed and unlicensed alike, to adhere to these ethical standards and become acquainted with the various norms and standards that are associated with what you are doing. So whether, again, I emphasize, you're licensed or not licensed, but still working within the area of human service, it's essential for you to become familiar with these codes of particular conducts. Now, in regards to moral standards, which is very important, it's what is owed to the patient. What moral standards, what counselors must adhere to in their care and treatment. One of the first things to look at is the autonomy of the patient slash client. So the autonomy of the individual must be respected. So while they may have problems, the client, they may have issues that come about, it is up to us as the counselor to try to give the best direction, the best guidance, but we still have to respect the autonomy of the decisions that are made by our clients. So we try to direct, we try to avoid putting bias of our own religious beliefs, our own morality upon them. That's a must. But at the same time, we have to respect what a client decides to do and not merely abandon them because they go against what we feel. Beneficence is another important thing, and that refers to causing no harm. So anything that would be bad, which is non-maleficence, which is below that, are things that would harm our client and how we talk to them, how we treat them, things that we might present that might not be what's best for them. So we're always, as counselors, looking out for our client. We're trying to give them the best advice possible, and we're trying to guide them as best as we can, causing no harm, only looking for the benefit, for the blessings of the client. Justice is another moral standard counselors should adhere to. Justice in how we treat our client fairly, but also justice in taking up social action against things that maybe our client faces on a day-to-day basis, and seeing those things in society and being an individual who is a watchdog in terms of bringing out things that need to be corrected within society itself. Fidelity is an important concept as well. It is how we are faithful to our client and also to our role that we play in regards to helping them, not just in what we do in terms of discussing issues, but also in keeping confidentiality and letting them know that it is a place of trust. And only in a place of trust can anything ever blossom in terms of healing. Finally, veracity is a concept where one is truthful, one is very open about the conversation. There are no false promises made. It is a truthful environment where the counselor is open and the client is open. So veracity is another area that involves very closely to fidelity, an idea of trust, but it is also an openness of no false promises and so forth. Now, within that important bond of trust, I want to go a little bit deeper into this where we talk about fidelity and veracity. We have to create an environment where it is conducive to discussion, where an individual knows that they can be able to discuss a sensitive issue without fear of retribution or judgment, and that they can be given a place to find healing. So when the whole process begins, whether you're a licensed counselor or whether you're an unlicensed counselor, you need to have an informed consent and confidentiality form. Within the informed consent, an individual lists pretty much everything about themselves. It's not only a back history that they list, but it's also a consent to discuss these issues, to understand the limitations of a particular therapy, and also to understand the confidentiality. Now, after that, I also have written on this slide limits of confidentiality. And this is extremely important in allowing the client to know what are the limits. So in many of the ACA forms and many of the other ones within social work, family service, as well as human services themselves, there is a confidentiality limitation. And that means if the client is to cause harm to oneself or to others, or if legally obligated by authorities, an individual can break a client's trust by telling the proper authorities to, and in this case, protecting an individual. So obviously, if a client during a discussion brought up that they had molested someone, then you would be obligated as a licensed or non-licensed counselor to discuss these issues with the authorities, or to have the person turn him or herself in regards to this. So it is something that needs to be reminded. If someone is about to express something very deep, and it seems like it's just not about therapy, but they want to share a secret, this is where it's important to, again, stress that limit of confidentiality. Not just at the beginning when they sign the informed consent, but reminding them throughout the process, in the middle, or at the very end, and letting them know what your limitations are. So in this way, you do not harm fidelity, or you do not harm the veracity of your statements. Now, obviously, pastoral counselors within a church setting have more stringent types of regulations. Some of them have a pastor-client regulation within the state that it makes it much more sensitive. And at the highest level, we look into Catholicism, where the seal of the confession is all binding. And so in those cases, we come across some ethical gray areas and so forth. Now, as we go down the list, we have securing sensitive information. Now, this is important in terms of paperwork. And of course, counselors are always recommended more documentation, the better, in case something were to go wrong later. So in creating this documentation, whether it's on electronic or paper, it is of the counselor's highest priority to secure this information so that there's no security leaks electronically, or that things are misplaced or laid out in the open for others to see. Because if it's an individual who is over 18 and they don't have a parental signature with them, then anyone over 18 information isn't to be shared with anyone else unless it is previously detailed in the consent form that their information is open to this person or this person, as well as with other doctors. Maybe they do not want you as a counselor to share other information with other medical professionals. And again, this is all within the informed consent. Now, another thing that involves, again, I mentioned veracity, is practice with one's abilities and title. So if you feel as a counselor that your expertise is not as good, say, in anger management, you're a lot better with grief, but not so much with anger, you should let the client know that you can take this individual only so far, and then you might want to refer. And this is a common dialogue. It's not just an authoritative statement. Also, if you're practicing within a title of an unlicensed counselor, and say you are working in grief, and someone who lost a parent or a sibling or even a child is no longer experiencing reactions to grief that are non-pathological, but begin to exhibit signs of depression, you would want to refer that person to a licensed counselor. So you don't want to practice with outside of your expertise and talents, as well as exercising your abilities outside of what your official title might be with the state. And it's very extremely important not to advertise yourself as a licensed counselor if indeed you're just merely pastoral counselor or an unlicensed counselor. You can fall into some deep legal troubles if that's the case. Also, when working with a client, again, this is going back to veracity and also fidelity, real expectations and timelines of treatment. Some cases are closed. You have a certain amount of sessions that you know. Some are more open-ended. So you want to give realistic expectations of what you can do, and also of the time frame that it might take for these types of treatments. Proper utilization of power is another key point, and this goes back to autonomy and also beneficence in terms of not harming your client. So proper utilization of your power means you are not pushing your own agenda, your own bias in a particular gray area that someone might have their own opinions about. You're guiding them, but you are not overutilizing your power to make them what you want them to be. Yes, they're coming to advice for you, but you are there to guide them, to help them make the decision, not make the decision for them. And that's key because then they become to develop their own autonomy and abilities to problem solve. And you want to help that. You don't want to give them a fish, so to speak, from the old analogy. You want to teach them how to fish. In addition to that proper utilization of power, sometimes avoiding improper situations or relationships or conflicts of interest can play a key role in keeping your power in line. So if you have a relationship, maybe in a smaller town outside of the actual relationship professionally, you might have an individual who comes to you and you buy something from them or they buy something from you. That can pose a conflict of interest that needs to be very carefully monitored. Uh, if you are in a smaller town again and maybe you do something at the school for their children, that could cause a problem where authority is kind of lost in the process, and maybe a improper use of power can emerge, not intentionally even, but unintentionally. So there will be an unequal playing field outside of the office due to your position in their life as a counselor. So you don't want that power to translate to other fields of communication if you do happen to know this individual through other venues. Now, of course, closer venues such as family or inappropriate romantic relationships totally distort the situation, and those need to be completely avoided because it's completely unethical to have a romantic relationship with an individual and be counseling them at the same time, because then we do have a very corrupted dynamic of where one party has more power than the other in terms of the counseling itself. So those are some things to consider. One other thing that can occur at times are the giving of gifts, and you want to keep it professional. So if someone's bringing in cookies or other types of small things, it can almost put that other client in a different light than your other clients. And it can also be seen as a way to sway maybe how you feel about the person. Now, there is an issue of cultural gifts. Some cultures might take offense if you're working within a certain diverse group, which you definitely do need to be aware of different cultures, especially when you're counseling individuals from different cultures. Diversity is key in understanding population basis. But some gifts would be, if rejected, a sign of insult to that particular society. So you really need to look into that. You need to see what your company you work for, your counseling company, or your employer considers to be an appropriate acceptance of gifts within particular exceptions or not, because you at that time have an ethical dilemma between your employer, yourself, and also your client. Again, the idea of preserving the autonomy of the patient. I kind of talked about it, avoiding imposition of personal beliefs. This can be difficult, especially if you're in Christian counseling, because obviously you are supporting a particular philosophy. And there might be a little bit more leeway with that because an individual is coming to you as a Christian for Christian advice. But again, you still have to respect, and that's where never abandoning a patient or client comes into play. It's very unethical and against every standard to suddenly stop seeing, stop taking calls of a patient. That causes damage, and we are here to cause no harm. So we never want to abandon a patient based on a disagreement. So if even in cases of Christian counseling and you were discovered that an individual lived an immoral life, or if an individual might be a homosexual, which is contrary to your Christian beliefs, you would not be permitted ethically to abandon that patient based on that, but to continue to work with them and discuss them and to respect their autonomy. So there's a lot of reasons sometimes individuals seek to abandon a patient. You have to put those emotions away and you have to work for the benefices of the patient or the client, their overall better health and outcomes. And so if something becomes unmanageable, this is where you work with them together and suggest a different counselor for them, but it's not a complete drop. There is a transition and there is a way to work through the issue so that the individual receives the help they need from a maybe a more appropriate counselor for their particular needs. But you by no means are abandoning them or canceling counseling sessions themselves. So those are a few standards. We're going to have a second episode on counseling ethics, and we're going to discuss some other issues that come across and go into some of the issues we already discussed, maybe in a little bit more detail. Again, these videos are not just for public consumption, but they're also for those taking our counseling ethics course, which is primarily for those who are not licensed and have not been informed about a lot of these standards and how to properly conduct themselves as certified non-licensed counselors themselves. So there's a couple of our counseling programs below, our grief counseling, our Christian counseling. The links are below. You can also email us at info@aihcp.org, and our phone is 330-652-7776. I'd like to thank you for listening and have a good day.